Alright you guys, so this video is going to go over the tooth surfaces. Bear with me, this is a two-dimensional drawing, so it can be a little confusing, but I think we'll be able to work through it. So this is a molar here that I have drawn, and this is a posterior tooth, and this is an anterior tooth, which we could consider that a central incisor, okay? So we're going to go over some of the surfaces that are equal to both of them, and then we will focus on some surfaces that are more specific to either anterior or posterior. So I'm going to color code it. I think it makes it a little easier. So, hope if my markers will work. Okay. So these first couple surfaces I'm going to go over go for both of the anterior and the posterior teeth. So the first one is going to be mesial. And if we are looking at these photos, our midline is going to be here. I will draw it for us. Here is going to be our midline. So what that means is that this tooth is obviously on this side of the mouth, so our midline is headed that way. And then if I had drawn teeth over here, our midline would be this way. So with that being said, mesial is going to be our first surface. And mesial, I always think of mesial midline. So I think of mesial being towards the midline. So if I were over here and I were looking at this tooth and I needed to find the mesial surface, I would find my midline first of all and then know that my mesial surface is towards the midline. So this is going to be my mesial surface. Same thing on this tooth. This is my mesial surface. Can you guys all see that in the blue? That is my mesial surface, okay? And it can it's gonna be up here as well, so. All right, so our next surface that we will look at will be our distal. If you remember studying in anatomy about distal or proximal, distal is kind of has a similar concept, distal meaning distant or far away. So if we have our mesial, which is toward the midline, our distal is going to be distant, which means it's going to be away from the midline. So this will be our distal surface. And then same thing on this tooth, this will be our distal surface. Okay, so in blue we have our mesial, and pink, purple, we have our distal surface. Okay. All right, so the next one that both of them share would be our lingual surface. This one is a little harder to draw because you could look at the tooth either towards the cheek or towards the tongue, and that really is our indicator of if it's lingual or buccal, and we'll talk about buccal in a minute, or facial. So, but lingual, and I will actually write this out, lingual is towards the tongue. Okay, towards the tongue is going to be our lingual. So if we were looking at this tooth, say we were inside the mouth, kind of just picture that, like we're inside the mouth looking out. This would be our lingual surface. Same thing with this tooth. Say we were behind the tooth, kind of around here if you can see. We were looking at the tooth from the inside. This would be our lingual surface, okay? And I won't keep these ones off because we're going to talk about another surface and we'll need to use this surface. And that other surface that we will talk about is your buccal / your facial. And this is, so for the buccal, This is going to be your posterior teeth. And the facial is going to be your anterior. Okay, so I'm going to go ahead and erase this. So if we were looking at the tooth from the outside of the mouth, and we were looking at the back tooth, almost if I pulled my cheek out, I can see this side without looking inside the mouth. I can see the kind of the outside, which buccal means closest to the cheek. So this would end up being my buccal surface. And like I said, only posterior teeth have a buccal surface. So that's one thing you're going to really remember is buccal and posterior are the only two. Posterior tooth only has a buccal. So if we're talking about our anterior tooth, they only have a facial surface, which is the front of the face. You can go ahead and see, when I smile, you can see that front surface. That's going to be your facial surface. So if we were looking at this tooth, if you were smiling at me and I was just looking at your mouth, your front surface is going to be your facial surface. Okay, so that's labeled in red. So sorry, I had to take away the lingual surface, but they really are, they kind of mirror each other, I guess, like one's front and one's back. So just really kind of don't get too confused on which is which right now with the two-dimensional drawings. When you have a typodont or when you're with a patient and you're in their mouth, like you really will be able to tell the difference and you'll really be able to know the difference. Just know the buccal is for only posterior and facial is only for anterior, whereas lingual is for both anterior and posterior. Okay, so the next surface that I'm going to show you is also only posterior. There is a lingual component of it as well, but it's a different name. So we have our occlusal surface, which is going to be our chewing surface. I'm just going to go ahead and write chewing. And like I said, this is only posterior. So as we see, this is my posterior tooth. If we were looking at the chewing surface, where food is, this would be our occlusal surface. So that is our occlusal surface. That's where we chew, and that's where the teeth occlude and hit together. And so that's why it's called the occlusal surface, and that's where you're going to find the chewing surface. The next one that is in connection with the occlusal but on the anterior tooth is called your incisal surface. Sorry, I'm drawing a blank on how to spell this at the moment. Okay, don't quote me on that, but this is our incisal surface. So if you think about the chewing surface, where is the chewing surface on your anterior teeth? Obviously we don't chew, but we do bite down. And if you remember going over the names of the teeth, you have your central incisors and your lateral incisors. So if you kind of think about that, your incisal surface and your incisors connect. And so when you bite down on something, you're going to be using this very front surface of your tooth. So that is your incisal. All right, so the next surface that we will look at is going to be there is another surface that is that you will learn about. It's not as commonly used. It's called the palatal surface. It's not as commonly used because lingual is the term that we use mostly for the backside of the mouth. But palatal, the palatal surface means that it's up against the palate. So let me go ahead and draw an upper tooth for you. So say we had, this is our upper tooth, sorry, can't see that. And this is where our gums are, okay? So palatal is really close to lingual. don't quote me on that spelling either. But your palatal surface is, I'm just going to say it's similar to your lingual. Okay, so if we were looking at this, say I'll use red again. Red, this could be considered our lingual surface. It's where our tongue touches. And then palatal can just be found a little above that. So that's more of your palatal. Here's your palate, where your gums are and everything, and the tissues up there. And so it's right up against there. So like I said, palatal is not as used as often, but it is one that you'll read about. So when you do read about, really just connect it with lingual. And then when we get into lab and we get talking more about surfaces and kind of going over different surfaces, that one will not come up as often. Some doctors probably do use it, some do stick with just lingual, and we probably will stick more with lingual. So just a little tip on that. So these are your surfaces. Surfaces are super important to learn because they will be used as you take notes for doctor, as you start treatment planning, as you start putting things into the patient's charts, as you start helping patients understand the kind of fillings that doctor is going to be doing that day. And also with surfaces, really remember their names, but mostly know what each abbreviation means. So if I gave you just an M, what would you be able to connect that to? You'd be able to connect that to mesial. If I gave you just a D, you'd be able to connect that to distal, because we will start to say things like MOD, for example, and that will refer to mesial, occlusal, which is your biting surface, and then your distal. So really just know your surfaces, and it might take a little time, but you guys will get there, and we will use it so much, and you will use this vocabulary every single day in your dental career. So really learn your surfaces, know them. If you need to print off a picture and start labeling them and coloring them yourself, go for it. That's a super helpful way to also learn your surfaces. Once we get more into classes, we'll talk more about the surfaces and how they relate to the different classes associated to cavities of the teeth. So there's surfaces for you.